Hello and welcome to this lesson, hemorrhoids. Hemorrhoids is one of the most common causes of rectal bleeding, and in this video we are going to talk about anything that you need for your board examination. So why do we have hemorrhoids? In case of hemorrhoid happens in patients who are suffering from chronic constipation or patients who are chronically straining during defecation. So with that, we have a weakness of trach muscles, and these are muscles that are embedded in the anal canal wall, and hemorrhoidal plexus are embedded through these muscles. So with chronic constipation or with straining, we have a weakness of trach muscle, and as the result we will have prolapse of veins into the anal canal. So this is why hemorrhoids happens. So what are the gradings for hemorrhoid? And these are usually defined for internal hemorrhoids. So we have 4 grades. In grade 1, we only have engorgement of the vessels without any prolapse. In grade 2, we have engorgement of the vessels with prolapse, but they have a spontaneous reduction ability. In grade 3, we have engorgement of the vessels with prolapse, and these prolapse can be reduced manually with the hand. And in grade 4, we have engorgement of the vessel which are prolapsing, but they cannot be manually reduced. So these are the 4 types of internal hemorrhoid that you have to know for your board examination. So what are the common locations for hemorrhoid? We have 3 classical locations. If this is anterior part of the body and this is the posterior, we have 3 classical locations. We have left lateral at 3 o'clock position, we have right posterior at 7 o'clock position, and also we have right anterior at 11 o'clock position. So these are 3 classical locations that you will see in case of hemorrhoid patient. So what are the presentations for hemorrhoids? We can have external hemorrhoid and internal hemorrhoid. So external hemorrhoid usually presents with sharp and acute pain and swelling and the lump at the anal area. If the external hemorrhoid has thrombosed, it can cause pain, and on the examination you can see purple swelling on the anal region, and also we can have chronic protrusion of hemorrhoid causing a painless lump, and there will be no change in the color of the lump in the anal region. In case of internal hemorrhoid, we can have bleeding, pressure-like pain. This is not a sharp pain, this is just a pressure-like pain and sensation. And because of the fact that these veins can lose blood, in the long term, they can cause anemia in the patient. So these are the important presentations of internal hemorrhoid and external hemorrhoid. And note that if hemorrhoid is incarcerated and gangrenous, it can cause necrosis, and skin of the mucosa will be black in color. So what are the examinations and findings in case of hemorrhoid? In case of external hemorrhoid, the patient can have thrombosed external hemorrhoid, and this will appear as a purple swelling and lump. Also, they can have external prolapse and tag, which is appearing as a protrusion and lump in the anal region, but this is usually without any acute pain and discoloration. So internal hemorrhoid will not have any sign if there is no prolapse. And note that digital rectal examination is only effective in case of external hemorrhoid. For internal hemorrhoid, patient should be undergo For internal hemorrhoid, patients should be performed with anoscopy in order to make the diagnosis of internal hemorrhoid. And note that all the patients with hemorrhoid should have proximal colon examined either with flexible sigmoidoscopy or colonoscopy if needed. We are going to talk about this in upcoming slides of what are the indications for flexible sigmoidoscopy and colonoscopy in patients who are suffering from hemorrhoid. And note the difference between devices that are used for examination of anal region. We have anoscope, we have proctoscope, and also we have rectoscope. So for diagnosis of internal hemorrhoid, we are going to use anoscope, and this is enough to make the diagnosis of internal hemorrhoid. Now, what are the differentials for hemorrhoid? Note that the 2 main symptoms of hemorrhoid is either rectal bleeding or prolapse. So if the patient is presented with rectal bleeding, patient should be also investigated for colitis, polyps, and cancer. And you can do this with either flexible sigmoidoscopy or colonoscopy, especially if the patient is anemic, over 50, or has family history of colorectal carcinoma. If the patient has prolapse of anal region, the patient should be also investigated for true rectal prolapse. Now, what are the difference between true rectal prolapse and prolapse in case of hemorrhoid? In case of hemorrhoid, you are going to see prolapse in classical positions of the hemorrhoid. So you will have right anterior at the 11 o'clock position. You can have prolapse in the right posterior position at 7 o'clock. And the patient can also have in the left lateral at 3 o'clock position. And also note that with prolapse, the patient will either have normal or increase in sphinctering tone of anal region. In case of true rectal prolapse, the patient will have whole circumferential prolapse of the anal mucosa, and also the patient will have decrease in sphinctering tone of anal region. So these are the differentials that you have to know for your board examination. So what are the treatment options for hemorrhoid? In case of hemorrhoid, external hemorrhoid, if the patient is presented with only external hemorrhoid and a skin tag, reassurance will be just enough. But note that most of the patients with hemorrhoid, either external or internal hemorrhoid, are suffering from chronic constipation. So all the patients who are presenting with hemorrhoid should get stool softeners, laxatives, and bulking agents in order to prevent further problems. So if the patient is having external hemorrhoid with irritation or discomfort in the anal region, topical hydrocortisone or analgesic cream can be used for this group of patients. If the patient is complaining from hygiene problem, simple surgical excision is suggested to this group of patients in order to remove the hemorrhoid from the anal region. And again, if the patient is presented with thrombus within first 3 days, again simple surgical excision is suggested to this group of patients so the hemorrhoid can be removed and the patient will not be suffering from pain in the anal region. In case of internal hemorrhoid, we can have a patient who is presented with grade 1 and grade 2, and also if the patient is having constipation, getting fiber and laxative and phlebotomics will be enough. So phlebotomics, these are the herbal extracts that help increase in venous tone and lymphatic drainage and prevent further problem. If the patient has hemorrhoid with diarrhea, note that the diarrhea should be addressed first and treated first, and only after that we are offering the patient surgical solution. So what are the surgical options in case of internal hemorrhoid? We can have a rubber band ligation. This is for grade 1 to grade 3, and this is actually very good surgery because it has a less post-operative pain and it has also a fast recovery. We can also have a sclerotherapy, which is usually used for grade 1 and grade 2, and also infrared coagulation, which can be used in patients who are suffering from internal hemorrhoid of grade 1 and grade 2. Another option is excisional hemorrhoidectomy, which is used for grade 3 and grade 4, but note that this is a very discomforting surgery because it causes significant post-operative discomfort, and it is usually done in lithotomy or prone position and has couple of complications that you have to know for your board examination. First of all, note that we can have infection at surgical site. Bleeding is also very common as a complication of excisional hemorrhoidectomy. Urinary retention can happen, and also as a late complication we can have anal canal stenosis. Another option is a staple hemorrhoidopexy, which is used for grade 2 and grade 3, and complications are rectovaginal fistula, rectal obstruction, and bleeding. And the last option is Doppler guided hemorrhoidectomy, which is usually used for grade 2 or grade 3 of internal hemorrhoid. Thank you for watching. See you in the next video.